important aspects of healthcare and public health infrastructures are vulnerable. The stakes go beyond politics. Higher premiums, reduced access, stress clinics, weaker safety nets. The healthcare debate undergirdling the shutdown is cost, values, access, and reform. And time matters. The longer funding is delayed, the greater risk system disruption. When the lights go off, healthcare in a government shutdown. Hi, welcome back to What the House Confessions of a Black Nurse. I'm your host, Delilah, and today we are going to talk about what the health when the lights go off, healthcare in a government shutdown. Now, on October 1st, the U.S. federal government entered a partial shutdown after Congress failed to pass the necessary funding. While some key programs remained operational, key negotiations did stall, and central among them was healthcare. So, we'll explore how the shutdown is affecting healthcare and multiple political perspectives from the Republicans, Democrats, and independents, and how it impacts the American public. We'll dig into why healthcare changes are on the table, what's at stake for the patients and providers, and what happens next if this gridlock continues. Buckle up, because this is a can't change the station conversation. This is really going to make you think about your health. Let's set the scene. What is a shutdown? What's at stake in healthcare? Okay. First, let's define what we're dealing with. A government shutdown occurs when Congress fails to pass appropriations for continuing resolutions, meaning certain discretionary programs and funding of many federal employees. Setting the scene. What is a shutdown and what's at stake in healthcare? First, let's define what we're dealing with. A government shutdown occurs when Congress fails to pass appropriations or continuing resolutions pertaining to certain discretionary programs. They can lose funding, and many federal employees can be furloughed. Crucially, not all programs are shut down. Mandatory spending, such as Medicare and Medicaid, continue because they are funded by laws. Still, healthcare services are being impacted. For example, the CDC, or Center for Disease Control, and National Institutes of Health both face major workforce disruptions in their research and investigations and inspections things. Some health center grants are also in limbo. So some nonprofit programs in states may have to temporarily stop. Subsidies for the Affordable Care Act marketplace are in dispute, and this is because it could raise premiums for millions of Americans. So while your doctor's office might still be open and your insurance card is still valid, the infrastructure behind public health and the access to the care is under strain. What ended on, or around then? The temporary expansion or enhancements of premium tax credits for the Affordable Care Act marketplace will expire after tax year 2025, so December 31st, 2025. And it will revert to pre-ARPA rules. The law prohibits implementation of enforcement of more generous Medicaid CHIP basic health program rules, simplification, reduce red tape, starting July 2025, and it was going to last through September 2034, effectively rolled back improvements that had been planned. The One Big Beautiful Bill Act enacts various cuts and stricter community engagement requirements for Medicaid that begin or phase in between 2020 and 2027. Some provider supports and state-directed payments that help subsidize Medicaid may be gradually reduced or capped, gradually beginning in later years. Some changes were phased in, but everything was to be phased in by 2028. One health-adjacent subsidy or support program, such as expanded eligibility for lower cost coverage, cost-sharing reductions, or enhanced marketplace limits, are also curtailed or reversed under the One Big Beautiful Bill Act. Yeah. There's not always a precise September 30th, 2025 cutoff for each change. Many are phased in, Enhanced Affordability Care Act subsidies are often cited as ending at the end of the 2025 tax year. Let's go over the political perspectives and why each side thinks this matters. Okay. So, why healthcare is at the heart of the shutdown stalemate? What's each party's stance on the issue? We'll look at three lenses: the Democrats' viewpoint, the Republicans' viewpoint, and then the independent or neutral third party's viewpoint. Okay. From the Democrats' perspective, they argue that the shutdown is being used as leverage to push through cuts to Medicaid and to the marketplace subsidies, in the marketplace subsidies. The premiums in the Affordable Care Act plans are poised to dramatically increase if enhanced tax credits lapse. So, for example, analysts estimate that subsidized enrollees' premiums could more than double. Democrats insist that you cannot wrap up a funding bill without healthcare protections included. The idea healthcare access is fundamental, and cutting it is politically and morally untenable. Their message, without extending the subsidies and reversing proposed Medicaid health program cuts, millions will lose coverage and costs will soar either way. From the Republican perspective, or their side of it, is the healthcare spending trajectory is unsustainable. The tax credits, the subsidies, the expansions, they say the cost too much threaten federal fiscal stability. Their position: first, pass a clean continuing resolution to reopen the government, then they can negotiate healthcare reforms. They resist bundling the major policy change into a short-term funding bill. They assert that reduced federal healthcare outlays, imposing work requirements and programs like Medicaid and different subsidies and legitimate reform objectives. And we'll have a link to that because that's from the One Big Beautiful Bill Act implication article. So, in the show notes. So, independents, or the neutral perspective, a lot of their analysts point out that yes, mandatory programs continue, but discretionary parts of public health infrastructure like the research, the inspections, the disease surveillance, they all are at risk. That the situation shows the fragility of the funding model. When Congress stalls, even major systems of delivery face collateral damage. The independent perspective often stresses whatever your political leaning: access to care, stable premiums, provider reimbursement, and health system financing matter to all of us. So they're saying that it affects us all, pretty much. So we have competing value frameworks: access versus fiscal restraint, immediate protections versus structural reform, reforming subsidies versus preserving them. Healthcare policy is not a sidebar in the shutdown. It's central to the shutdown. It's why the shutdown is occurring. And this matters because the people that are doing this still have healthcare. Their healthcare will not change regardless. And they are still being paid, but they are not doing their job, regardless of what side you're on: Republican, Democrat, or independent. People don't care about healthcare until they need it. They don't need it right now, so they don't care. But let's dig deeper into how the shutdown is really affecting Americans, patients, hospitals, clinics, insurers. Here are some key areas: premiums and cost of insurance, enhanced ACA marketplace premium tax credits are expiring unless Congress acts. Without them, people will pay significantly more premiums. It's just what it is. One estimate: a family of four earning $75,000 could pay $5,800 in premiums if subsidies expire, from $2,400, $2,500. In that scenario, the cost insurance begins to threaten affordability of middle income, which is already threatened due to inflation and cost of food and everything else. Access to care in clinics and local health systems. Federally qualified health centers serving underserved populations rely on federal grants. With shutting funding down, uncertainty, they face operational risk, which they could close doors that they may be less hesitant to open, and it still disrupts patient care. Hospital and health systems warn they can't absorb additional costs while already facing pressures. They just can't do it. Telehealth and hospital at home waivers that got expanded during COVID are now in jeopardy due to policy riders that will expire. Once again, limiting access to physicians and providers, public health infrastructure, and safety net, with significant portions of the staff at the HHS, CDC, and NIH facing furlough. Functions like disease surveillance, health research, inspections, they're all at risk. For example, the regulatory oversight activities of the FDA, they would continue because they are required to, or they'd continue for revenue fee funded parts, but other functions would just be curtailed because they're not being paid. Outcomes for the general public. For average Americans, you still get your Medicare and Medicaid benefit now, but you may face higher premiums. Fewer clinics open or that take it, you'll have longer wait times, less access to telehealth, fewer public health updates, and risk of less regulation and oversight. And if the shutdown drags on, long-term risk is structure, more uninsured people, more pressure on hospitals, higher costs for all. Yeah, we all know the insured pay for the uninsured. It's not theoretical. The chain of impact goes: the policy standoff, which government shutdown; funding lapse or reduction, government shutdown; operational stress on healthcare, which is occurring now, ripple to the individuals and families. That's the real story. That's what happens. That's the chain. So this is going to affect us all. It's just, where are you in the chain? Why change is needed? The underlying healthcare debate. So why are these healthcare reforms under debate in the first place? Let's look deeper into the reasons of that. Behind the push to change healthcare funding and design, healthcare spending is huge. For example, federal healthcare spending in 2024 was approximately $2 trillion, nearly 30% of the federal budget. Growth is unsustainable. Expanding eligibility, rising costs per enrollee, aging population. Reformers argue that without structural change, deficits and debt will grow, which is true. Some point to inefficiencies, waste, and lack of value-based care as justifications for cuts or reform. But patient advocates like myself, I believe my concern is different. My concern is access, affordability, equity for everyone. Typically, reforms don't protect the vulnerable, even though they should. Telehealth and innovative care models, which expanded during COVID and have been a blessing to keep people consistent and on top of their health care, those would be also gone, not keeping pace. The top 5 public impacts, the uninsured population and coverage loss. With the enhanced subsidies ending, many people won't be able to afford marketplace plans, and they'll just go without. That could be approximately 4.2 million people could lose coverage solely just from that one change. Combined with Medicaid eligibility tightening and other cuts, total uninsured numbers could rise by tens of millions over a decade. More uninsured persons means lower access to preventative care, delayed treatment, and worsening of chronic conditions, raising morbidity and mortality. Higher premiums and cost burdens for these who remain insured. Withdrawal of enhanced subsidies means that those who remain in the marketplace plans will face higher out-of-pocket costs because, like I said, the insured pay for the uninsured. The pool of uninsured may skew towards the higher risk individuals because healthier people drop coverage, driving up the premium costs, further adverse selection, I guess, Cost barriers may push insured individuals to underuse needed care, skipping medications, skipping office visits, skipping screenings. Tighten Medicaid eligibility and those work verification requirements under the One Big Beautiful Bill Act introduces the first federal community engagement work requirement. So to get Medicaid, many enrollees between the ages of 19 and 64 would have to perform 80 hours per month of work, volunteer, or education to maintain coverage, which is ridiculous. More frequently, eligibility verification means a redetermination process, plus, an increase in administrative burden, increased risk of, people losing coverage and falling through the cracks, which is definitely going to happen. Some Medicaid simplification rules intended to reduce this burden are blocked from going into effect through 2034. So yeah, it's just going to overrun the system. Some states may choose to disenroll individuals who fail to comply with the rules, even temporarily, adversely affecting continuity of care. Strain on the safety net providers, hospitals, and health systems, and coverage shrinks and more people become uninsured. Safety net, hospitals, community clinics, and Medicaid-reliant providers will see increase uncompensated patients. That's just how it works, and they'll have to suffer the burden. Unfortunately, that's how it goes. Decrease in state-directed payments, provider taxes, and matching federal funds will reduce resources for provider support, particularly in rural underfunded areas, which are the areas that need it the most. Financially stressed hospitals may cut services, reduce staffing, or close departments, reducing access, especially in underserved regions, worsening health disparities and delayed public health gains. Populations are already vulnerable in low-income communities and racial ethnic minorities, and they're disproportionately impacted. So yeah, preventative services, screenings, immunizations, chronic disease management, all that's going to decline in uptake, reversing public health gains. Delays and gaps in care exacerbate chronic disease, lead to more emergency visits and hospitalizations, and widen life expectancy health equity gap. In short, a healthcare system legacy is expansive, sprawling, and a shutdown forces the question, can we continue as we go? Or do we need to reform? But one thing is clear, whatever path is chosen, the public is watching and the consequences are real. We will all be impacted. In conclusion, we traveled through the landscape of this government shutdown. What it is, how healthcare is central, what each side is arguing, and how the public is being impacted. The key takeaways are this. A shutdown doesn't mean everything stops, but does mean important aspects of healthcare and public health infrastructures are vulnerable. The stakes go beyond politics. Higher premiums, reduced access, stress clinics, weaker safety nets. The healthcare debate undergirdling the shutdown is cost, values, access, and reform. And time matters. The longer funding is delayed, the greater risk of system disruption. So, where do we go from here? Here are 3 questions for you or our listener to reflect on if premiums double or access shrinks. How would it affect you, your family, your community? Question 1, if premiums double or access shrinks, how would it affect you, your family, and your community? Question 2, how do you weigh the value of reform? Cost control, system change, against preserving access and stability. And question 3, what role should you play as a voter, as a patient, as a consumer in holding policymakers accountable for healthcare policy amidst budget fights? Thank you for joining me today on What the Health. I so appreciate you spending your time with me. Please make sure you subscribe or follow. Take a second if you can on whatever platform you're listening and leave a quick rating and review. It helps push us out there to everyone. And it's a great free way to support. Thank you again. Bye for now. Be safe out there. Be well.